Good morning. I'm John Woodrich, CEO of Bryan Medical Center, and welcome to the press briefing on Tuesday, July the 28th. I wanted to share with you some of our testing numbers. So as of today, we've tested 16,962 individuals. We have 2,027 positives and 111 pending. Did want to share with you, we have made some great progress with our third-party lab that we send our tests out to, and our turnaround has been less than 2 days, and we've been running at that now for a week to a week and a half, so we're really pleased with the progress with our outside lab. Today's midnight census is 413. We have 7 positive COVID patients in-house, 4 from Lancaster County, 3 are from outside of the county. One of those individuals is on a ventilator. We have 2 in our ICU unit, 1 in our progressive care unit, and 4 in our general care unit. I think we have shown that when people do social distance and they wear masks and they focus on washing their hands, that is a safe environment. I think it will be up to us to continue to educate our children appropriately on wearing the mask. And as you heard earlier from one of our pediatricians here in the community, this is a great time to be working with your children about getting them used to wearing a mask. You know, we have proven here, even within the hospital, as we have taken care of a number of COVID patients, we have not had a hospital employee acquire COVID through interaction with COVID patients here. So if you take the proper precautions and you have the protective equipment, such as masks and washing your hands and that, it can be a very safe environment. I know that when school opens up, if people do get a little more lenient and don't wear masks and there is an outbreak, I know that's a fear factor for all parents. But what we can do is continue to work with our children on wearing the mask appropriately, and also not continuing to play with it. And it's tough to do. I will tell you, it's not comfortable wearing a mask all day long. But we do have to try to get back to educating our children appropriately, getting them back into the classrooms and getting them to have that social environment that they have with their classmates as well. I think that's similar to what I just gave. I think you will hear a variety of opinions from different individuals. We will make sure, and I know our health department and our doctors and the experts that we consult with are making sure that we're creating a safe environment for this community and the public welfare. So I think we'll have to support those decisions that are made. I think there are some very bright people that are helping us make these decisions in a collaborative nature to get schools opened again. We were having conversations. I know people have had graduation parties this past weekend, and we hear some of those stories where there has been large groups of people congregating in homes and no one's wearing a mask. If that type of behavior continues, I think you will see the spike occur of COVID-19. But I think the people that are taking the proper precautions and social distancing and wearing masks, that will help alleviate the spread of this. But we just have to continue to educate people on the importance of this.